We now move 2-to-1 questioning. I recognize Mr. Smith, Nebraska.
Thank you, Mr. Chairman. Thank you to our entire panel for participating in what I think is a very timely discussion, something that I think should be on all of our minds. And looking at, Medicare Advantage has been around for some time now, and I think we have a lot of data to draw on. I think hearing from seniors, many of whom appreciate being on a Medicare Advantage, I think we ought to pay attention to that, but also look a little deeper than that and make sure that we are formulating policy that is good for seniors, good for their health care, and certainly good for our country. And so I think there's some things we can take away, and the flexibility and creativity, if you will, that some plans offer that actually contribute to better health, that as Ms. Maroney was speaking about. I think we need to be mindful of that. I represent one of the most rural districts in a very rural state, and so there's not as much participation, as you know, not as many options that would exist for patients across my district. And I want to make sure that seniors have the choices that can lead to higher quality outcomes and cost savings as well. I hear from providers that are concerned about additional paperwork. That leads to cost, obviously. Now, in all honesty, there are some providers who are saying they don't want to participate at all, and that should get our attention in a hurry. And when the beauty of the system should be a plan in discussion with providers can come up with a good solve for patients. That's what we want. And so when perhaps a provider feels shut out, I think that should be addressed. But Dr. Basel, I certainly appreciate the services that are offered by Avera in my district. And I know that Avera is involved both on the hospital side and the MA plan equation. I know you're very familiar. And how would you say Avera has operated differently than other MA plans in order to succeed in rural areas where other plans have actually encountered challenges?
Thank you, Representative Smith. And, earlier I talked about, the transportation issues in many of our rural areas. One of the facilities in your areas in O'Neill, Nebraska is one of those places where we've worked with coming up with a transportation system of our own. But in general, prevention we talked about is one of the key things that certainly plays into here, but coordination of care is the other thing, and that's where I think Avera has an advantage, being both a healthcare system as well as the payer there, because we can do that care coordination, reduce that fragmentation of care, and then shift towards the prevention side. And so, it's all about that alignment of incentives. You talked earlier about why don't we do more prevention, and it's about that alignment and that time horizon. Prevention is going to save us money 10 years, 20 years down the road, and so how do you get to the short-term thing so that you can reinvest it in that prevention that's going to save you money on down the road?
Okay. Where could you say CMS could take steps to ensure that rural seniors continue to have access to high-quality MA options?
So you think about network sufficiency is one of our biggest problems in getting access to MA plans, certainly in a lot of your constituents, because they're so rural that being able to get specialty care within the guidelines. And so that's something that you've worked on in the past to network adequacy problems. That continues to be something that we look to partner with, some of the changes in telemedicine to allow us to do a little bit more in those areas, but also it gets to some of those coding intensity changes as too. That's a have and have nots. And so if you've got certain MA plans that are very aggressive about coding intensity, ones like us that take more of a clinical approach to, if you're not managing that disease clinically, then it shouldn't be, on that chart. We get hurt by those across-the-board coding intensity reductions, and so trying to go after only those that have the more aggressive tendencies as opposed to putting across-the-board reductions would be very helpful to smaller plans like ours.
Okay, all right. Well, I appreciate your perspective, and certainly it's been mentioned already what some of the good parts are, what the challenges are. I'm very concerned about straight-up fraud that takes place, that I would hope we have the tools necessary to address that, realizing there are some good parts of this that we don't want to lose as we sort things out. So thank you, Mr. Chair. I yield back.
I now